King's Theory by Spencer, Olivia, Renea, Shristi, and Josh. Submitted to Dr. Santos, Samuel Merritt University, N138, Introduction to Nursing and Healthcare. What goals can we set together to restore the patient to health? Imogene King. Imogene King answered the national call for nurses during World War II, beginning a career that would shape the future of nursing. After earning advanced degrees in both nursing and education, she taught and led programs across major universities and served in influential government roles. King developed the theory of goal attainment, which emphasized shared goal setting between the nurse and patient. Her work reached international audiences, especially in Japan and the Philippines, where she received some of nursing's highest honors before her passing in 2007. Imogene King became a nursing theorist by asking a powerful question: what is nursing? With advanced education and mentorship from leaders like Mildred Montag, King explored systems theory and behavioral science. She noticed a gap between what was taught and what was practiced in nursing. That inspired her to create a practical framework which became the theory of goal attainment, focusing on nurses and patients working together to set health goals. Her theory helped elevate nursing as a discipline grounded in science, relationships, and human potential. King's nursing theory of goal attainment is based on the idea that nurses and patients must work together to achieve health goals. For this to happen, communication between the nurse and patient needs to be mutual, respectful, and clear. It's important for the patient to actively participate in this process because both the nurse and the patient must discuss and agree on the goals that the patient will work toward. When patients are involved in setting their own goals, they are more likely to feel motivated to follow through. As King stated, the goal of nursing is attaining or regaining health. King's theory is grounded in the belief that patients are whole, complex individuals, not just a set of symptoms. To support this, she outlined 3 interacting systems that help nurses understand the full picture of a patient's life: personal, interpersonal, and social. The personal system focuses on the patient's self, how they see themselves, their identity, and how they make sense of the world around them. This includes their thoughts, feelings, and personal perceptions, which influence how they experience health and illness. The interpersonal system involves the relationships between the patient and others. It includes close connections like family and friends, as well as the nurse-patient relationship. These interactions can deeply impact a person's motivation, stress levels, and willingness to engage in care. Lastly, the social system looks at the larger structures the patient is part of, like school, work, community, and faith organizations. These social settings can support or sometimes limit a patient's ability to achieve their health goals. Together, these 3 systems allow nurses to see patients not just in terms of biology or treatment plans, but as people influenced by their inner world, relationships, and environments. Understanding these layers helps us deliver care that is not only effective, but meaningful. At the heart of King's theory is mutual goal setting, the idea that nurses and patients work together to identify health goals and take steps towards achieving them. This happens through a dynamic process that includes interaction, communication, perception, and transaction. As we see in this diagram, the nurse and patient bring their own perceptions and experiences into the relationship. Through clear communication and collaboration, they engage in a transaction process, essentially a shared decision-making effort that leads to goal attainment. King also uses a systems approach, considering not just the individual, personal system, but also their relationships, interpersonal system, and the broader environment, social system. This theory emphasizes the importance of patient-centered care and shows how vital our communication skills are in promoting positive health outcomes. Unlike the step-by-step linear model we often learn, assessment, diagnosis, planning, implementation, and evaluation, King's model views the process as simultaneous, dynamic, and interactional. According to King, nursing is a process of action, reaction, and interaction, where nurses and patients engage in mutual goal setting to improve health outcomes. She identified 6 components. The first is perception, how the nurse and patient see each other and the situation. Judgment, how each person processes that perception. Action, both take steps based on those judgments. Reaction, they respond to one another's actions. Interaction, they develop mutual understanding. And through transaction, they agree on and work towards shared goals. The diagram on the slide shows how nurse and client perceptions, judgments, and actions create a feedback loop, reinforcing that nursing is a relationship-based, reciprocal process. In essence, King redefines the nursing process as a mutual, evolving exchange focused on shared goals. It's not just what we do to patients, it's about what we accomplish with them. While King's theory of goal attainment is widely respected, it does have some limitations. One factor is complexity. The theory's intricate nature can be challenging to implement in fast-paced healthcare settings. It is also time-sensitive. Mutual goal setting and continuous communication require significant time investment. Regarding patient capacity, the theory might not be fully applicable to patients with altered mental states or communication difficulties. In addition, the theory might not align well with all cultural perspectives on healthcare relationships. Its overemphasis on goals focuses too heavily on goal achievement at the expense of other aspects of care. Its limited applicability may not be suitable for all nursing situations, particularly in emergency or critical care settings. The necessity of patient engagement assumes that patients are willing and able to actively participate in their care planning. The theory also has the potential for conflicting goals. Specifically, the nurse and patient might have difficulty aligning their objectives. Although it provides a framework, it doesn't offer concrete nursing interventions. Lastly, there's the difficulty in measuring outcomes. The subjective nature of some concepts can make evaluation challenging. Although there are some limitations, Imogene King's theory of goal attainment provides strong and convincing reasons to be applied in nursing practice. First, the patient-centered approach emphasizes the importance of patient involvement in their own care and the decision-making process. Additionally, its goal-oriented care focuses on setting and achieving specific health goals collaboratively with patients. Its holistic perspective considers personal, interpersonal, and social systems, thereby providing a comprehensive view of patient care. The improved communication encourages effective nurse-patient interactions and mutual understanding. Its adaptability can be applied to various nursing situations and specialties. The structured process offers a clear framework for assessment, planning, intervention, and evaluation. It promotes autonomy, empowering patients to take an active role in managing their own health. It enhances the nurse-patient relationship by fostering trust and collaboration between healthcare providers and patients. It considers context by acknowledging the influence of social and environmental factors on health outcomes. And through continuous assessment, it encourages ongoing evaluation and adjustment of care plans to ensure goal attainment. By using King's theory, nurses can provide more personalized, effective, and satisfying care that aligns with patients' individual needs and goals. Imogene King's theory of goal attainment applies to nursing practice in a way that is both deeply relational and highly adaptable. At its core, the theory emphasizes that effective nursing care is not just done to patients, it's done with them. In practice, this transforms how we interact with patients at the bedside and beyond. First, King's theory builds trust by prioritizing mutual goal setting. When nurses take the time to truly listen to patients and co-create goals based on the patient's values, there's a greater sense of investment on both sides. Patients feel seen, heard, and respected. And we, as nurses, are better able to tailor interventions that matter to them. Second, it encourages patient engagement and autonomy. In modern nursing, we're moving away from the one-size-fits-all model. King's theory aligns with today's patient-centered approach by inviting individuals to take an active role in their own health. Whether it's a diabetic patient deciding on improving their nutrition, or someone in rehab working on mobility goals, the theory frames nursing as a partnership. Another important aspect is communication. In dynamic, high-pressure environments, we often rely on clear, concise exchanges with patients. King's framework reminds us that every interaction, no matter how brief, is part of a larger process that includes perception, judgment, action, and response. This is especially important in clinical practice, where misunderstandings can lead to poor outcomes. The theory is also highly adaptable. Whether we're in pediatrics, mental health, critical care, or community nursing, the structure of personal, interpersonal, and social systems helps us consider the whole person, not just their diagnosis. For example, in home health, we might factor in a patient's social isolation or family dynamics as part of goal planning. Finally, King's theory enhances the nurse-patient relationship. By recognizing that both nurse and patient bring unique perspectives and experiences, it creates a space for empathy and mutual respect. This strengthens not only the quality of care, but also job satisfaction for nurses. In summary, King's theory isn't just a theoretical concept, it's a practical guide for making care more collaborative, effective, and human. It reminds us that healing starts with connection, and that our greatest impact often begins with asking a simple, shared question. What goals can we set together?